I think that it's important that we understand the relationship between childhood mental health, trauma, and resilience. We know that mental health disorders in children are extremely common. About 1 out of every 4 kids in the United States has been diagnosed with a psychiatric disorder. This is a lot more than even the number of kids with diabetes, with cancer, who have an HIV positive status, of all of those kids combined. So what we know, that although it's not talked about, mental health disorders in kids are much more common than physical health problems in children. 50% of all psychiatric illness occurs before the age of 14. So we know that this is happening early. It's happening in childhood. Many times it's happening before a child reaches high school. So what we know is that all children are at risk for developing a mental health disorder. But there are some factors that put kids more at risk than others. As you may guess, exposure to stress, toxic stress, exposure to trauma puts kids at a significantly higher risk, not only to develop a mental health disorder, but also to have access to treatment for that mental health disorder. The most common mental health disorders in children are anxiety disorders, ADHD, and depression. Let's take a look at the 3 main categories of mental health problems that these diagnoses fall into. So we see that these diagnoses fall into the categories of anxiety disorders, behavior disorders, and mood disorders. If we think about the connection between trauma and stress and the impact that trauma and stress have on our central nervous system, we can see the connection between these 3 main categories of mental health problems in kids. As you can see on this infographic, if you start at the beginning, if trauma and toxic stress is at the root of what is impacting and influencing a person's central nervous system, you can see how that would lead to the first category of mental health disorders called anxiety disorders. So a telltale sign of trauma and toxic stress is that you have hypervigilance or hyperarousal, hyperactivity. So it would make sense that the child would say something like, I feel so jumpy and nervous. My body has a racing heart. I have a lot of worry. I have a lot of fear. Kids present with fidgeting, being sensitive to sound, to movement, to different sensory inputs in the home or in classrooms. They may appear to be sweaty or nervous. These are all signs and symptoms of the experience of anxiety. So if we think about how trauma and toxic stress impact the central nervous system, you can see how that looks like an anxiety disorder. After experiencing those symptoms and reactions of anxiety for quite some time, children then move to behaviors that allow them, or what they hope will allow them to cope with or manage that hyperactivity, hypervigilance, or hyperarousal that they feel in their body. So they may say to themselves, how can I manage this anxiety that I feel in my body? This is why we see kids that appear to be significantly hyperactive, getting in and out of their seats, running around in the classroom. These are kids that look like they have very poor attention. They aren't able to concentrate. And then kids that move into more of the aggressive, defiant behaviors. Kids that look like they're very disruptive. They appear very dysregulated in the classroom. They seem to be very angry. You can see how kids in this category of mental health disorders can be easily diagnosed with something like ADHD or oppositional defiant disorder. This behavior disorder category is a true next step of somebody who has been experiencing anxiety or hypervigilance for a long time. Then if you move up the infographic, you see the next category of mental health disorders that's very common in children are mood disorders. So if you have a child that's had a lot of anxiety, and then they have moved into trying to cope through their behavior choices, then they begin to think to themselves, why can't I control myself? There must be something wrong with me. This leads to feelings about self that include feelings like depression, feeling sad, maybe withdrawing, maybe being scared, having low self-confidence, not feeling good about themselves. And then ultimately, as you shift over to the at-risk coping strategies, kids that feel this way say, I just want to feel better. And then we see this reliance on alcohol and drug use, self-harm, and eating disorders. So I put this infographic together as a way to be able to illustrate this pathway from toxic stress to trauma, up into anxiety disorders, then behavior disorders, then mood disorders, and then ultimately the adoption of at-risk coping strategies. It's really interesting to note the onset of these disorders. So what we know is that the average onset of anxiety disorders in children is about school age. It's about age 6. So that's what comes first. The onset of behavior disorders in children happens a little bit later. So ADHD, oppositional defiant disorder, you begin to see about age 9, 10, 11, a little bit later in that elementary school age range. And then the onset of mood disorders we see in adolescence. And then when do we see substance abuse and self-harm and the use of other at-risk coping strategies like joining gangs or involving themselves in promiscuity or stealing or contact with the court, really engaging in rule-breaking behavior. That is often seen at that high school age. So the onset of these very, very common mental health disorders in children really correlate to what is happening in their central nervous systems as they grow and develop as a result of their exposure to trauma and toxic stress.